Cardiac tumors are rare growths in the heart, which can be primary or secondary. Diagnosis involves imaging tests and histopathological evaluation. Symptoms can vary, and treatment requires a multidisciplinary approach. Long-term follow-up is important for patient outcomes. This video covers all aspects of cardiac tumors. Cardiac tumors are rare, comprising less than 1% of cardiac disorders. They can be primary, originating within the heart, or secondary, metastasized from other organs. Primary tumors include myxomas, lipomas, and sarcomas, while metastatic carcinomas are common secondary tumors. Location, type, and clinical presentations dictate diagnosis and treatment. Primary cardiac tumors, such as myxomas, lipomas, fibromas, rhabdomyomas, and sarcomas, have distinctive clinical presentations. These tumors can obstruct blood flow, cause arrhythmias, or lead to heart failure or embolic events. Prompt diagnosis and treatment are crucial. Secondary cardiac tumors result from the spread of cancer cells from other parts of the body to the heart. Symptoms can vary and may include chest pain, difficulty breathing, fatigue, abnormal heart rhythms, or accumulation of fluid around the heart. Treatment typically involves a team of specialists and may include chemotherapy, targeted therapy, radiation, or surgery. The prognosis is generally poor, underscoring the importance of early detection and intervention. A variety of imaging modalities are necessary to accurately diagnose cardiac tumors. Echocardiography provides initial information about tumor location, size, mobility, and hemodynamic disturbances. CT and MRI enable detailed characterization of the tumor and evaluation of nearby structures and myocardial function. PET with FDG aids in distinguishing between benign and malignant tumors, detecting metastasis, and assessing treatment response. New techniques like cardiac MRI with late gadolinium enhancement and 18F fluorodeoxyglucose PET/CT show promise in improving diagnostic accuracy. A systematic approach to imaging is crucial for proper management of cardiac tumors. Histopathological evaluation is important in distinguishing benign from malignant cardiac tumors. It involves examining tissue samples through microscopic examination, staining, and genetic analysis. Benign tumors have well-defined borders, while malignant tumors exhibit invasive growth patterns and genetic alterations. This evaluation aids in diagnosis and treatment planning. Cardiac tumors can have a wide range of clinical presentations. While many benign tumors remain asymptomatic, they can be detected through routine imaging or during postmortem examinations. Symptomatic tumors can present with various signs and symptoms, such as dyspnea, chest pain, palpitations, syncope, arrhythmias, heart failure, embolic events, or unexplained weight loss. The specific manifestations depend on the tumor's size, location, and potential for obstruction or embolization. Diagnosing cardiac tumors can be challenging due to their similarity to other cardiovascular conditions. Therefore, a comprehensive clinical evaluation, along with a high level of suspicion, is crucial for timely diagnosis, proper management, and prevention of complications. Cardiac tumors require a team of specialists. Treatment options include surgery, chemotherapy, targeted therapy, radiation therapy, and supportive care. Surgical resection is the primary treatment, but palliative interventions and chemotherapy may be used for inoperable or advanced tumors. Individualized treatment plans are crucial for optimal outcomes. In the video, we discuss surgical techniques for primary cardiac tumors. The goal is complete tumor removal while preserving cardiac function. Various techniques are used depending on tumor characteristics. Minimally invasive approaches have advantages. Heart transplantation is considered in certain cases. Adjuvant therapy alongside surgery aims to improve outcomes. The selection of surgical technique requires careful consideration. Cardiac biomarkers play a crucial role in diagnosing, prognosticating, and monitoring cardiac tumors, especially in malignant cases. Natriuretic peptides, such as BNP and NT-proB, help assess hemodynamic burden and predict heart failure. Elevated cardiac troponins indicate a higher risk of adverse cardiovascular events in patients with cardiac tumors. Other biomarkers like soluble ST2, galectin-3, and myeloperoxidase are promising for evaluating tumor burden and predicting prognosis. Regular monitoring of biomarkers helps evaluate treatment response, detect relapse, and guide therapeutic modifications. However, further research is required to determine their efficacy in specific tumor types and routine clinical practice. Genetic predisposition is important in cardiac tumor development. Mutations in specific genes, like PRCAR1A, TSC1, and TSC2, are linked to different tumor types. Testing and counseling are crucial for at-risk individuals and can guide screening and prevention strategies. Understanding inherited mutations helps in finding therapeutic targets. Cardiac tumor embolism occurs when tumor fragments or thrombi detach and travel through the cardiovascular system. This can cause various symptoms, such as chest pain, dyspnea, or stroke. Diagnosis can be challenging, but imaging tests can help confirm it. Treatment options vary depending on the situation. The prognosis of cardiac tumors is influenced by tumor type, grade, invasion, and metastasis. Benign tumors have good outcomes after surgical removal, while malignant tumors have poorer outcomes. Long-term follow-up and surveillance imaging are necessary for monitoring recurrence and managing complications. Cardiac tumors are rare and can originate within the heart or spread from other organs. Accurate diagnosis and management require a multidisciplinary approach. Advances in imaging, surgery, chemotherapy, and genetic testing have improved outcomes, but further research is needed to enhance our understanding and treatment of cardiac tumors.